More than half of working-age Americans are struggling to pay for health care, even if they have insurance. That's according to a recent survey which found rising costs have caused nearly 40% of Americans to skip necessary treatments and medications. 4 in 10 Americans with employer-sponsored plans or Medicaid have difficulty paying for health care. 3 in 4 people without insurance say they can't afford to pay for their care. CBS News MoneyWatch reporter Megan Cerullo is here in Studio 57 to talk about her reporting here. So, Megan, just break this down for our audience. I mean, it's no surprise that in this country people struggle to pay for health care. I think what many people who have good health care coverage will say is, wow, there are people that are insured that can't pay for health care.
Right, we're talking about Americans with insurance, and while it is better to have health insurance than to not, they're saying that it's inadequate, and as a result, they're avoiding care, they're delaying seeking treatment for medical conditions, and as a result, they're getting sicker and poorer, and they're putting off treatment because there are costs like copays, coinsurance, deductibles that they simply can't afford. So it's making Americans sicker and poorer.
And so I guess the question is sort of why, right? I know that why has insurance gone up recently? Is that what part of it is? I know after COVID, my insurance certainly went up, and that was kind of the explanation that they gave, like that it just was so expensive during COVID. What's going on?
We have a more complicated healthcare system in the U.S. than in other countries, like the UK, for example, and it's driven by prices that are set by providers and by like hospitals and by pharmaceutical companies. The other thing that we're seeing happening is some employers that provide their employees with employer-sponsored health plans are narrowing their networks, which is exposing folks to more out-of-pocket expenses if they go out of network, for example, and that's driving up costs. I mean, it's something I consider. If I have a deductible I have to meet, or if I have a copay, it's like, well, how badly do I need this?
Yeah.
So it's interesting because we reference other countries, the UK, for example. I lived for many years in France, and I often wondered to myself, my taxes were very high because France does have a socialized medical system, but I always enjoyed being able to go to the doctor and not have any exorbitant bills. But that being said, I was healthy. And I wonder, there are people in the UK, there are people in Canada, there are people in France who say, look, if you are not healthy, even under this socialized system, it's better to be in the United States than it is in these other countries. I don't know if what kind of credence you lend to that argument.
I'm not sure about that, but there are fixes. There are policies there are changes we can make so that we can better insure the population. That can include subsidies for lower income folks. It can include charging less, lowering the premiums based on an income scale. So folks who earn less, because the study did show that people who make less have a harder time, and it's eating into household budgets. They can't afford rent payments, utilities.
What about just lowering the
groceries?
price of treatments and drugs? For example, we talked about insulin before, right? Insulin, the patent on that expired years ago. It should be a relatively cheap medication, and yet pharmaceutical companies charge exorbitant prices for it.
Right. This probably speaks to the complexity of the system that we have these insurance companies that negotiate with healthcare systems to determine the cost of, an appendectomy. It may cost one thing for insurance company A and cost something way more expensive for insurance company B.
Indeed. And so the survey found that this is driving Americans into debt. They're accumulating medical debt. And the Biden administration has actually drafted new regulations that would prohibit medical debt from appearing on one's credit report, because that's really hindering a lot of Americans. So there are fixes, including those subsidies and legislation like this that could begin to remedy the problem.
You can see it being sort of a worsening cycle, right? You don't go to cover kind of basic medical needs because you don't want to spend the money, you don't have the money, and then those balloon into a major medical crisis that you can't avoid, but you also can't afford.
That's exactly right, and that's a problem that's unique to the U.S.
Yeah.
Wow. I mean, it's so interesting. I didn't realize that there was legislation being proposed to not have medical debt appear on your credit history. And I would guess that student loans would be another way to alleviate that. But I'm sure that on the flip side, the credit agencies and the companies who make money off of people are like, no.
Yeah, I'm
Because
sure
then
they'll
what
be
else is
arguing
there?
that.
It's just your bad spending habits that would end up on your credit, not something that you got into because you were sick or because you had to pay for your education.
Right.
Fascinating discussion. Megan,
Thank
always
you.
great to have you. Thank you very much for your reporting. Appreciate
So
it.
much.